I work for a supply chain business process engineer. So started up a central distribution center for the Providence Health System, which covers 32 acute care locations, over 400 clinics. Designed that system, implemented it, and then as we've kind of progressed and matured that, we've decided we want to really focus on the forward deployed locations to make that even more successful.
I'm a Lean Six Sigma black belt, work with operational excellence, dedicated to supply chain. Got into power optimization from a request to look at the data and understand why we're doing things. The importance in Lean when you're looking at data and process is you really have to understand what and why people are doing things to put in a solution that's going to make sense in the long run and actually have sustainability. So my background comes in, I get to facilitate all these great minds that might just be data focused, might just be process focused, blend those two together and come up with the optimal solution. So Lean Six Sigma actually has a great tool set if you follow that recipe, right? It'll allow you to navigate through that and come up with a sustainable solution.
And being an engineer from the warehouse, really your concepts are rooted in slotting logic and optimization of space. And when we looked at the PAR locations, which is the forward deployed inventory within the ministries or hospitals, we found that that same concept could be applied to those forward deployed locations. And it's really measuring the amount of air, understanding the movement of materials, the velocity, and making sure that the right product is in the right spot, in the right amount to reduce the amount of touches we have to take.
So we went straight to the PARs and we wanted to understand what people were doing. So the first step is, what's working well, what's not working well. And from there, you can actually tie that in with the data again to understand what needs to be done so that we can feel the hands that heal at the end of the day and provide the right product to the point of use. The biggest issue we found was the reactive approach. There was really no proactive maintenance going on when it came to PAR management. We found that there was 40 to 60%, sometimes 75% of obsolete inventory in any given location, which is a huge red flag. We didn't look at PARs in certain circumstances for 2 years, 3 years. So that was a big shock. And what we needed to do is figure out how we can be proactive, work with our clinicians, and set a new standard of maintaining PARs moving forward.
We started seeing single combs going out to hospitals and replenishing those locations, and that's where we went, aha, okay, something is wrong, and it's not the fulfillment side, it's got to be the demand side. And that's where we went into the field, really dug deep and said, hey, why are we sending things that are not worth the cost of shipping? And by targeting that, we kind of needed to look at the whole picture, a big data set. We looked at big data and targeted the worst ones and then continuously improved through that to make a big difference. Some
of the reaction was, leave me alone. I don't want to do this. I've been doing this for 30 years. Step back, let me do my thing. But I would say the majority of the staff was excited to engage, wanted to help, had great ideas, and provided all of the information we needed to be successful.
We just reached out to the people we know that are experts in their field, got their insight and input, partnered with local ministries and staff to pilot the test processes. Once we saw that it was successful, we ramped it out and just grabbed the best people we could find and we integrated them into the process.
I always say that you could have the best process out there, but if you don't get the people side of it, you're never going to change it. So one of the huge keys with PAR optimization is understanding the behavior behind it and reinforcing that positive behavior so that they know they're doing well. You're not just leaving them out to dry, and you're going to come back, right? You're going to come back and talk to them, and you're going to work together on the success of PAR optimization versus this is what we want you to do and walk away. So if you focus on that behavior, kind of massage that relationship and build that trust, 100% successful.
The combs are interesting because as we saw PAR locations and we did our assessments, we probably saw 100 PAR locations, all different shapes and sizes. We really needed to find a common element, something you could look to and go, how is the health of this PAR location and is the strategy that they've implemented correct? And that comb is literally on every single PAR location, okay? It comes in a pack of 12. And most oftentimes you're going to see it in the each. And when you see just one single comb sitting in the bin, that goes, aha, okay. They don't understand, best unit of measure. If the bin's not full, you go, oh, they're not understanding the cost of movement, or the efficiency of space utilization, right? I mean, so real quick, you can look at that one item in any par you go into and assess where you're at as far as the realm of optimization. The frustrations with lack of supplies was really the problem, and really the data showed, hey, we know there's a problem. This bin isn't big enough. We know you don't have enough inventory here. Let us help you and put more up here. Okay, and we're going to reduce some of the inventory that you're not using. Okay, so win-win. So that's an opportunity to talk to that clinician and say, hey, we know there's a problem, and this is the picture and footprint we need to do to fix it.
We were able to take their daily workload of coming every single day and focusing their efforts on other projects that needed to be done. In some cases, we cut their delivery days in half because they just didn't need it. We were able to get the right inventory there and have it last for longer periods of time so that they can focus their efforts on other projects that we needed them to do.
Ground level work is really, the end of the day, what had to occur first. Rolling up the sleeves, making the changes the data was telling us to make, getting resources to make those changes, and then once it was proven, okay, engagement with that frontline staff was completed, and they bought in one location, it was much easier to grow it to the rest of the system. And so physically being there, proving that the data was showing the correct things, making sure that we were doing the right things was critical to get clinical buy-in and make sure that we had no risk to supply chains fulfillment. Really starting at the ground and moving upwards. There's a lot of synergy between, hey, what is the best unit of measure in that distribution center? How does it work? And then, hey, does that work for the space constraints within those 4 deployed locations? So, yeah, you got to start with data. A great approach to the clinicians and getting that buy-in is to go, I don't know much about healing people, or I'm not a clinician, but I am a supply chain, professional. Here's the data of your consumption, and let's partner to make sure you have the right inventory. So that approach with data-driven analysis is really, I think, lacking in some regards in this field, and it's an easy-to-present, actionable data set that really gets the buy-in you need to get moving forward. The data is already there within our system, which is Lawson, but we didn't need a software package. We didn't need a big contract or a vendor. We just needed people that understood data and Excel, really. That's all it came down to. And so this is easy to implement in any system that has access to the right data. Any location that you have deployed inventory to buffer consumption, okay, you want to make sure that that's right. You want to monitor and maintain it so that as things change within your hospital and workload, you've got the right supplies at all times, rather than what I think historically has been there, which is place and forget, right? And always fill up the same thing. So it's absolutely scalable, and it absolutely does not require very much money to implement. It's just resizing locations based on the consumption. We're seeing about 1 million less issues. That's taking something from a stockroom and moving it. We're seeing about 1 million less in the system over the year. I don't know what the cost of an issue is, but it's significant. We're seeing a reduction in delivery days. So how many days do we fill up a hospital's 4 deployed location? We're seeing that come from 7 to 3 in a lot of locations. That's significant transportation savings as well. We're seeing less calls for necessary supplies, less stat calls, less couriers. And we're also seeing a greater dollar value moving through the supply chain in a more efficient way.